always haven't eaten right, maybe a little overweight, but I've always exercised and tried to do all the right things. So having been told that I had a heart attack rather than maybe walking pneumonia I was taken back. But the diagnosis was a mild heart attack with some damage, and it was caused by blockage in a couple of arteries.
The shortness of breath obviously was a warning sign. I should have picked up on that. You kind of tend to think that, well, it's not going to happen to you, It just got worse instead of getting better.
Well, I think people are choosing to come to the Heart and Vascular Center here in Brainerd because of the convenience of being able to receive their care close to home. And I hope also because of the quality of care that we've been able to deliver to the patients in this region. I think you need the available technology that patients require to deliver testing and diagnosis and therapy. But I think you also need the personnel behind that equipment. That a medical center is much more than just the testing equipment that's within its walls, but it's really the people that work within the walls to deliver that care.
Having an interventional cardiologist is so important to us because it means that we can have things done locally without traveling to other facilities. We can put stents into the heart and do that right here at home, and you don't have to go elsewhere.
When a person comes in with a heart attack, they're scared, they're having discomfort in their chest, they're sweaty and they're short of breath, and this is a serious issue. We're able to take that patient, calm them down, bring them to the cath lab, and really within a matter of minutes reestablish adequate blood flow to the heart, and then all that discomfort and shortness of breath resolves. So the ability to have that done here in Brainerd without having to hop on an ambulance or a helicopter is just a wonderful thing for this community.
I grew up here, and it means so much to the community when they see a familiar face and they come in and receive that care. There are friends and family that we treat, and we take that to heart, literally.
We have extremely high patient satisfaction. Part of that reason is we have a smaller center. You're not going to see a whole slew of doctors. You're going to see myself, Dr. Rich, maybe one of my partners. But that's it, and we're all experienced people.
The results really speak for themselves. The fact that I'm here today feeling good, being able to enjoy life again, is a real testament to the work that Dr. Rich, Dr. Johnson, and the team at Essentia did.
We have a staff that just love what they're doing. And because of that, I think that we try our hardest to accomplish those goals, which are basically to optimize the patient's experience when they come to our program.
To have these services available in Brainerd, I think, is very important. For me personally, I feel that it prevented me from having a heart attack. I do know, though, that if I do have those symptoms, to come in just a little bit earlier than I did this time. Don't ignore your symptoms. That's number one. And always think of that it can happen to you even if you think that it can't.
Every heart does tell a story.